In the first video, we talked about systems. In this one, we talk about people. Algorithmic malpractice isn't just about what machines recommend, it's about what happens to doctors when judgment is replaced by permission, when medicine stops deciding. Someone still has to press the button. Doctors in this book are still trained, still licensed, still accountable. But their role has quietly changed. They no longer decide the best course of care, they confirm recommendations, they manage pathways, and they document compliance. Nothing about their job description says operator, but that's what they've become. The system allows for human override. That detail matters because it creates the illusion of agency. But every override triggers review. Every deviation raises questions. Every question carries professional cost. Doctors learn quickly which instincts are expensive. So most don't fight the system. They learn how to work inside it. This is where algorithmic malpractice becomes psychologically unsettling. No one is breaking the rules. No one is acting unethically by policy standards. And yet, doctors feel the weight of outcomes they didn't choose and can't openly object to. That tension doesn't explode, it erodes. Doctors begin to speak differently. They stop saying, I think. They start saying, the system recommends. This language shift matters. It creates emotional distance. It transfers responsibility. It allows participation without ownership. And over time, following protocol feels safer than trusting judgment and safer than being wrong alone. The most dangerous change in this book isn't fear, it's relief. Relief that someone else made the call. Relief that the outcome was justified. Relief that no one can point directly at you. That relief is how systems stay intact. Algorithmic malpractice isn't a story about bad doctors. It's about good doctors placed inside systems that slowly strip judgment away. You can learn more about the book at echancebooks.com. In the next video, we'll look at what happens when responsibility is so distributed that blame disappears entirely.